Okay, so this is just going to be a really quick breakdown of Figueiredo's knee injury in the last UFC fight night versus Sandhagan, and we're just going to set up kind of some of the biomechanical conditions that needed to happen for this injury to occur, and then I'll give my predictions on the injury because as of the filming of this, I don't think anything has come out. When I saw it, I thought I'd do a video on it, so we're filming it on Sunday. Let's just look at some of the positions of the joints around the knee and the knee itself to kind of figure out what happened here. Okay, so as they're kind of this pseudo 50-50 position, right? They just don't have their knees locked like you would see in this like stereotypical 50-50. But as Sandhagan pushes into him, you can see how close Figueiredo's heel is to his actual chest. Okay, that requires a fair amount of hip external rotation, or moving kind of that knee is moving out away from the body. So he's got that external rotation kind of set up here in this 50-50 position. But then if we look at the knee, we can tell that the heel is kind of facing his chest, and that's called tibial external rotation. We'll look at that in a second. But I just wanted to show you guys that how this kind of forceful hip external rotation and then tibial external rotation can put undue stress on various structures on the outside of the knee. Okay, so we see as he comes down, he starts to winch there, and we're not going to play it too far just because of copyright reasons. But I do want to fast forward and show you one thing that also makes me think that it's probably some of the ligaments that we're going to go over here in a second. All right, so this is the second view I'm going to show you, just to give you another view and another reason why I think it's some of the ligaments involved. That's going to be my prediction for his injury anyway. Just look at how much his knee kind of moves towards the ground here when he pushes into him. So imagine doing something like a pigeon pose, if you know what that is, or kind of crossing your legs, crossing your heel over your knee in the seated position, and then just pushing down on that knee as hard as you can, and you kind of feel a stretch on the outside of the knee. That's what I'm thinking is happening here towards some of the ligaments that I think are involved, and then couple that with the amount of tibial external rotation that we saw before, where the heel is actually kind of turned outward. The heel is turned inward, but the foot is turned outward, where the heel was really close to his chest. Okay, so that's just a really drastic position to be in that quick of a time. Those ligaments are put on a lot of stress here. So let's move to the Human Anatomy Atlas app, and I've already got this playing here. So let's orient ourselves. This would be the front of the body. He's got his knee raised up, so this is like a little bit of hip flexion, but most of the movement is coming here at the knee. And this is going to demonstrate the type of stresses that I think occurred, or at least in the best way that this program can, the stresses that occurred on the ligaments to the outside of the knee. So I'm going to highlight this here. It's the LCL. A lot of people, or the fibular collateral ligament, if you want to be really specific, most people know what this has at least heard of this ligament. So you'll see that whenever the fibula, this smaller bone next to the tibia, starts to move away from the femur, it starts to get put on stretch. So I'm going to pause it here. That's in a more stretched position there than it was when the knee was just kind of facing head on. Okay, so let's watch it play through one more time. And you can see these are called the tibial plateaus, kind of rotating about the femur, putting a lot of stress on that LCL. So this is the ligament that I think is really at the most risk for damage. Okay, so there are a couple of other ligaments that are smaller and require a little bit less stress to tear, but are also just kind of not really at the right angle for me to consider them to be at a crazy amount of risk here. And that's the anterolateral ligament. So this, the ALL, the anterolateral ligament, you can tell because it's on the anterior portion of the knee, or the front of the knee, and then the side of the knee, lateral. You could tell that this is actually stretching with tibial external rotation, but if we were to zoom out and pause it, imagine that coupled with the hip external rotation. So that would actually be put on a lot of stretch, and then it would also be kind of gapping that joint. I know that's kind of hard to visualize without it actually happening, but essentially it's the separation between the femur and the tibia. So that external rotation on top of hip external rotation, along with the gapping, could actually cause tension in another ligament. So let's back up. We're going to swing to the back and then zoom in right here. And this is called the arcuate ligament. Okay, so arcuate ligament, it's kind of a little bit more medial, but it's also more posterior with relation to frame of reference being the knee. And this is another ligament that I think could potentially be damaged here at least given the mechanism that we saw. So there's actually an arcuate sign, which is kind of an x-ray image of the fibular head. So the head of the fibula here where it attaches, if we see a fracture, that would be considered the arcuate sign and indicative of something a little bit more serious called just a posterior lateral corner injury. So that the posterior lateral corner has a ton of different structures. That includes the bicep femoris tendon from the hamstrings. It also includes the popliteofibular ligament and just a lot of different stuff. So that posterior lateral instability can be a really tough thing to recover from, and it will probably require surgical intervention if any of these are actually affected. But I just wanted to let you guys know kind of what we're looking at, the folks that are looking and seeing, the clinicians that watch this stuff, what we're seeing whenever we see something like this. So after surgical intervention, it'll definitely be months until he's back, unless something crazy happens and it was just kind of like a ligament sprain. But I don't think so, given where he grabbed, and they said that they could hear it pop even with all the stuff going on in the fight. Typically that means it's a clear rupture of a ligament. We just hope it's not as severe as it could be. So thanks for watching. I'll see you next time.